What if I told you that the way most older men have been masturbating for decades, out of habit, stress relief, or simple routine, might be silently damaging their erections, weakening their prostate, and even draining their energy and confidence? I know that sounds shocking, but after 30 years of treating men over 60, I can tell you, the cost of not knowing the truth is far greater than most realize. I'm Dr. Rena, a physician specializing in men's health and sexual wellness. And after working with thousands of older patients across the country, I've seen firsthand how small changes in daily habits can lead to remarkable transformations in a man's vitality, intimacy, and self-worth. You've likely never been taught how to adjust your sexual habits with age. No one handed you a guidebook for how your body, brain, and hormones evolve over time. That changes today. Because there are 6 masturbation secrets every older man deserves to know. Secrets that can help you feel stronger, function better, and even restore a deep sense of connection to yourself. And before we finish, I'll reveal one powerful mistake nearly every man makes without realizing it, one that silently robs you of your erection strength. Stay with me. Before we dive in, if you care about protecting your health and restoring your vitality as you age, I invite you to subscribe and turn on the notification bell so you never miss another life-changing tip made specifically for men over 60. And if this message speaks to you, type 1 in the comments. If not, type 0. Your feedback helps me improve and serve you better. All right, let's get into it, starting with one of the most common mistakes older men make, often without realizing it. It's a simple habit you probably developed decades ago, but over time, it can quietly rob you of sensitivity, pleasure, and even the ability to maintain a strong erection. Let's talk about your grip and why changing it could change everything. Secret 1, your grip might be hurting you more than you think. I want to start with a habit so common, so automatic, most men never stop to question it. I've spoken to hundreds of older men, fathers, veterans, widowers, who all shared the same private frustration. Their erections weren't what they used to be. They'd lost sensitivity, struggled to finish, or felt disconnected during self-pleasure. And almost every time, the culprit was the same: the way they were gripping themselves. See, when you're younger, you can get away with a lot. A tight, fast, forceful grip might have felt good at 25. But after 60, it slowly starts to work against you. The skin becomes thinner, the nerve endings less responsive. Blood flow doesn't bounce back like it once did. And yet, many older men still hold on, literally, to the habits of their youth. What most don't realize is that a consistently tight grip can lead to a condition doctors refer to as desensitization, or what some call death grip syndrome. Over time, you may find that real intimacy doesn't stimulate you anymore. You need more pressure, more friction, more intensity, until eventually even that stops working. That's the price no one warned you about. Pleasure turns to frustration. Confidence erodes. Intimacy becomes avoidance. Some men spiral into isolation, thinking something's wrong with them, when in truth, it's the method, not the man. I've had patients break down in my office, convinced their sex life was over. And yet, with just one change, a lighter grip, more awareness, a softer, more mindful approach, they begin to feel again. Not just physically, but emotionally. That's the power of awareness, and that's the danger of staying in the dark. Now, I'm not saying never touch yourself, I'm saying respect the way your body has changed. Masturbation isn't a race. It's not about pressure, it's about sensation. And when you stop chasing release and start listening to your body, you begin to reclaim a part of yourself you thought was lost. So if you've ever felt numb, disconnected, or unsatisfied, even after climax, take a moment to ask yourself, how am I touching myself? You might be surprised how big the answer really is. But the grip is just the beginning, because in the next secret, we're going to look at something even more dangerous: how often you're masturbating, and why the wrong frequency could be silently draining your testosterone, exhausting your body, and sabotaging your health without you even realizing it. If you're still here and these truths are resonating with you, type the number 1 in the comments to let me know you're listening and that this matters to you. Now, let's keep going with the second secret. Secret 2, frequency matters more than you were told. Let me tell you a story that still sticks with me. A man in his early 70s came into my office. not because of pain, but because of emptiness. He said, "Doc, I don't feel like myself anymore. I'm tired all the time. I can't focus. I don't enjoy sex the way I used to, but I'm still masturbating every day, sometimes twice. I thought it was healthy. Isn't that what they say, to keep the pipes clean?" It's a message many older men have absorbed. The more you ejaculate, the better for your prostate. But here's the truth no one talks about. Yes, ejaculation does help reduce the risk of prostate issues, but too much can slowly tear you down. And that's especially true when it's driven by habit, boredom, or emotional emptiness rather than real desire. What most men over 60 don't realize is that frequent masturbation, especially daily or multiple times a day, can drain your hormonal reserves, spike and crash your dopamine levels, and push your nervous system into a state of near constant fatigue. I've seen it again and again. Men who are deeply exhausted, foggy in the head, emotionally flat, disconnected from real intimacy, and they have no idea that their routines might be the cause. The body isn't built the same at 70 as it was at 30. Testosterone takes longer to rebuild. The nervous system doesn't recover as quickly. And the more you drain your reserves without giving yourself time to rest, the more you push yourself into a state of depletion. That's the price, a slow erosion of vitality, focus, and sexual strength. And the cruel part is, most men don't see it coming. They just think they're getting old. But aging doesn't have to mean shutting down. It means adapting, listening, respecting the rhythms of your body. When I asked that patient to cut back, just to 2 or 3 times a week, paired with better sleep and more intentional practice, within a month he said, "Doc, it's like I woke up again. My mind's sharper, my energy's coming back, even my erections feel fuller, all from adjusting the frequency." So if you're running on empty and don't know why, this may be the place to start. But frequency is just one piece of the puzzle, because in the next secret, we're going deeper into the most powerful part of your body that controls not just your erection, but your entire experience of pleasure. And chances are, you've been neglecting it for years without realizing it. Secret 3, the mind is more powerful than the penis. One of the most heartbreaking things I hear from older men is this: "I just don't feel anything anymore. I try to get aroused, but nothing's there. It's like my body's disconnected from my desire." And I always tell them, what you're feeling isn't failure. It's a signal, and most of the time, that signal is coming from your brain, not your body. You see, we've been taught to think of sexual health as a physical issue: blood flow, hormone levels, prostate size. But what gets overlooked far too often is how much mental stimulation controls everything. And for many men, the mind has been rewired in ways that are slowly killing their sexual connection. That rewiring usually starts with pornography. Now, I'm not here to shame anyone. I understand why men turn to it. It's easy. It's always available. And for a lot of men, especially those who've lost a partner or struggle with loneliness, it becomes a routine. But here's the dangerous part. Over time, relying on constant visual stimulation can change the way your brain responds to arousal. It sets the bar higher and higher until real life, real touch, real connection just doesn't do it anymore. The cost? It's not just weaker erections. It's emotional detachment. It's that empty feeling after climax. It's the slow decline of confidence and closeness, not just with others, but with yourself. I've seen men drift into depression, convinced their manhood is gone, when the truth is, they've just trained their minds to respond to a kind of stimulation that doesn't exist in real life. I once had a patient, a retired teacher, who told me he hadn't been able to climax with his wife in nearly 2 years, yet had no trouble when alone. We worked together for 3 months. He cut out the videos, started using memory, fantasy, imagination. He slowed down. He reconnected with his body. And one day, with tears in his eyes, he said, "I felt something again. I thought I lost that part of myself." If you've been feeling numb, disconnected, or frustrated during intimacy, or even just with yourself, it may not be your body that's broken. It may be time to retrain your mind. And speaking of retraining, what if I told you there's an entire group of muscles inside your body that controls your erections, your climax, and even your bladder? And most men never learn how to use them. In the next secret, I'll show you where they are and how just 5 minutes a day could change everything. Secret 4, the pelvic floor is your hidden power center. When most men think about sexual strength, they think of blood flow, testosterone, or maybe even pills. Almost no one thinks about the muscles you can't see, the ones sitting deep in your pelvis, quietly holding the key to your performance, control, and long-term function. I'm talking about the pelvic floor. In my years of practice, I've seen what happens when men ignore this part of their body. I had a patient once, a retired mechanic in his late 60s, who told me he used to feel solid, strong erections, good control, no problems. Then slowly, over time, things changed. He started leaking urine when he laughed or coughed. His orgasms felt weaker. He couldn't last as long. And worst of all, he started avoiding sex altogether. Not because he didn't want it, but because he was ashamed. That's the price of a weak pelvic floor, and it creeps in silently. These are muscles that lose tone just like your arms or legs do if you don't use them. But unlike your biceps, you don't see them shrinking. You just feel the consequences. Soft erections, premature ejaculation, loss of sensation, even prostate complications and incontinence. What makes this even more frustrating is that most men never even hear about these muscles, let alone learn how to strengthen them. Yet just a few minutes a day can lead to noticeable improvements in firmness, stamina, and overall confidence in bed. The muscle you're looking for is the same one you'd use to stop your urine midstream. And yes, you can train it. I've had men in their 70s and 80s regain strength they thought was long gone, simply by doing targeted exercises called Kegels. No equipment, no medication, just awareness and commitment. When you reconnect with this part of your body, something incredible happens. Not only do you feel stronger physically, but emotionally, you begin to feel in control again. You stop fearing those intimate moments and instead start looking forward to them. And here's what most don't realize. This one area, the pelvic floor, is deeply connected to your prostate, your bladder, and your ability to stay independent as you age. But even if your muscles are strong, there's still one overlooked factor that could be quietly sabotaging your sexual health. And it all has to do with when you choose to release. Timing, as you'll see in the next secret, isn't just important. It can mean the difference between restored energy or total exhaustion. Secret 5, timing changes everything after 60. If there's one thing aging teaches us, it's that timing matters. And that couldn't be more true when it comes to sexual health. Most men never consider that when they choose to masturbate could impact their energy, mood, and even long-term hormone balance. But after 60, your body follows a different rhythm. And ignoring that rhythm can come with a heavy price. I remember one man in his late 60s, a widower, who told me he had developed a nightly habit of masturbating just before bed. "It helps me sleep," he said, but over time he started noticing something strange. He felt drained in the mornings. His sleep wasn't as deep. He woke up feeling more tired than when he went to bed. He chalked it up to age, but it wasn't that simple. What he didn't know, and what most men don't, is that testosterone, the hormone that fuels your sex drive, muscle strength, mental clarity, and confidence, is produced mostly during your deepest sleep, especially in the first few hours of the night. When you ejaculate right before bed, you cause a sharp drop in dopamine and other neurochemicals. That crash can disrupt your sleep cycle and block the hormonal rebuilding your body depends on. Over time, the cost adds up. You feel sluggish, lose drive, and struggle to get real rest. Your erections weaken, not because your body's broken, but because it's exhausted. This is the hidden price of poor timing, something so subtle, yet powerful enough to drain your vitality day after day. Now contrast that with men who learn to align their habits with their body's natural rhythm. I've encouraged patients to shift their self-pleasure to mornings or early afternoons, times when testosterone levels naturally peak, and the results are often surprising. Better focus, more energy, stronger libido. One man even told me, "It's like I've got my mornings back. I feel more in charge of my day and myself." So if you've been wondering why your energy is fading or your erections aren't what they used to be, take a close look at the clock. Sometimes the issue isn't what you're doing, it's when you're doing it. But even timing isn't the whole story. Because in this final secret, we'll uncover something even deeper. Something that's not physical at all, but emotional. A truth about intimacy, loneliness, and the hidden reason many older men give up on pleasure altogether without even realizing they have. Secret 6. Intimacy still matters, even when you're alone. This one is the hardest for most men to admit. It's not about technique, it's not about hormones, it's about something deeper, something that lives in the quiet corners of a man's heart. As we age, many of us begin to feel less desired, less connected, even invisible. And when we do masturbate, it often becomes something mechanical, hidden, or even shameful, done quickly, without thought, without feeling. But here's the truth I've learned after decades of listening to men: pleasure without intimacy slowly becomes emptiness. I once had a patient, 72 years old, who told me he hadn't felt true closeness, not even with himself, in years. "I do it because I still can," he said, "but I don't feel much, and afterward, I feel lonelier than before." That's the price no one talks about. It's not just about the act, it's about the disconnection that builds when you treat your own body like a stranger. When self-pleasure loses its emotional meaning, what remains can actually deepen feelings of isolation, sadness, even grief. What's most tragic is that many men believe this is just how aging works, that intimacy is for the young, that touch and connection have an expiration date. But I promise you, that's a lie. Intimacy never ages. You can still experience deep pleasure, warmth, emotional grounding, even if you're alone, if you learn to approach self-pleasure with presence, intention, and care. Masturbation should never be just a release. It can be a form of self-respect, a ritual of self-connection. Light a candle, slow down, breathe. Use memory, imagination, or gratitude. When you engage with your body from a place of respect, not just need, something shifts. You feel alive again. And that feeling doesn't just stay in the bedroom, it carries into your posture, your mood, your relationships, your entire sense of self-worth. Men who lose this connection often withdraw from life. They stop dating, stop expressing affection, stop believing they're worthy of touch. That's the real cost, not just physical decline, but emotional retreat. And it doesn't have to be that way. Because now that you know these 6 truths, these 6 secrets, I want to show you one final piece. It's something I only share with my private patients. A simple, powerful method that can reignite circulation, sensitivity, and performance, naturally without pills or procedures. And the best part? It only takes a few minutes a day. Let me show you how. Conclusion. If you've made it this far, then you already know this wasn't just a list of tips. It was a wake-up call. And not just about masturbation, but about how deeply your habits, your thoughts, and your emotions are connected to your health as a man over 60. These 6 secrets, each one is simple, but none of them are small. Together, they can either quietly steal years of strength from you or help you reclaim the confidence and vitality you thought were gone for good. Think about it: a grip too tight that slowly kills sensitivity, a routine too frequent that quietly drains your hormones, a mind overstimulated by screens and detached from real connection, a pelvic floor neglected, weakening your foundation, poor timing that steals your energy before you even sleep, and worst of all, self-pleasure stripped of intimacy, turning into a hollow ritual instead of a healing one. That's the price older men are silently paying every day, without ever being told there's another way. And I don't say this from a distance. I say this as someone who sat across from thousands of men who were hurting, confused, and ashamed to even ask the questions. I've seen their frustration, I've seen their fear, and I've seen the power of what happens when they begin to take back control, not just of their body, but of their dignity. Because the truth is, aging doesn't mean giving up. It means getting smarter. It means listening more closely to your body and finally giving yourself permission to ask, what do I really need to feel whole again? These 6 changes aren't just about improving your performance, they're about restoring your connection to yourself. So, wherever you are in life, married, single, widowed, divorced, know this: it's not too late. You're not broken, you're not beyond help, and you're not alone. You deserve pleasure, you deserve peace, and you deserve the truth. In my next message, I'll share a technique I teach privately to older men, one that activates blood flow, restores sensitivity, and supports prostate health in a natural, powerful way. But for now, take a breath. Take these truths with you, and most importantly, take yourself seriously. You still matter, your health still matters, and your story isn't over yet.